This is Perspectivas Latinas, a community service of CAN TV. I'm your host, Juan Carlos Hernandez. Our guest is Collins Yearwood from Healthcare Alternative Systems. He is here to talk about how they help the community deal with issues that range from addiction to domestic abuse, and also helping enroll the community in the Affordable Care Act. Welcome.
Thank you. Thank you.
Great. So let's start off by talking about you and how long you've been a part of the organization and what your role is there.
Sure. I came to Healthcare Alternative Systems in toward the end of September of 2013. Healthcare Alternative Systems was starting a program to enroll folks in healthcare. As part of the Affordable Care Act, they received a grant or applied for a grant and received a grant to create a new team of enrollers to enroll folks in the in healthcare. This particular team was a mix of persons of color and bilingual persons as well, because that's part of who they serve. That's part of the community they serve. Our offices are our main offices in Humboldt Park, and it has deep roots in the Hispanic community. It started out in 1974 as kind of an alcoholism treatment center.
Right.
And some of the programs include domestic violence counseling, substance abuse counseling, prison reentry, that is people who are coming out of prison who have substance abuse problems, and helping them integrate back into society, for example, with getting housing and things of that nature.
And job placement, I imagine, as well.
Yes, they do try to help people seek opportunities, but it's definitely also a lot of behavior modification, and by that I mean there's like courses in anger management and really just trying to get back into society. They have a lot of skilled and trained counselors who do a lot of that work.
So you're essentially the new kid on the block.
Yes, sir. We are the new kids on the block.
The group. How many people were brought in for this? This important.
Sure. We started out with 10 counselors,
10
and
counselors.
Certainly that certainly integrates into part of their vision, because you have these people coming in, many of whom do in fact need health care.
Right.
So here we are starting with a new program that's helping people to get involved, and guess what? You have people coming through the door every day who basically fit that kind of profile. In our particular case, and in our efforts, we have maybe about 80% of the enrollments we've done have been people in Medicaid, because there are a lot of people who are facing financial challenges, and that's a big part of the community we serve. So yes, we're the new kids on the block, and it's a little different in that we are not necessarily in the office. We are in the community. We are out and about. We are partnering with hospitals, with churches, with libraries. We will meet people at a fast food place, wherever they need to be to get coverage. If there's a Wi-Fi signal, we'll be there. Yeah.
So even if you find one in the street somewhere.
I'm sure that's happened. I'm sure that's happened. But yes, I've gotten calls from the son, the nephew, the niece of a person who I helped enroll, and where are you? Well, okay, well, I'm over here. Okay, and meanwhile, I'm Googling their location and saying, okay, it looks like there's a fast food place not too, like 3 blocks from you. Great, let's meet over there. So we are different. We don't follow the clock in a traditional 9 to 5.
Wow.
We try to get to wherever the people are, whenever, however we can get to them.
So essentially, a person is interested in or needs to get enrolled, and they call you, or somebody calls you, and they make an appointment. How does that work? We're past the deadline now. But,
yes, sir. Yeah.
But people still have the opportunity to enroll.
Correct. We set up a hotline. It was 773-634-5009. We can still enroll people because they do have what's called a special enrollment period. There's certainly people who were not able to complete their enrollments due to various factors. A lot of them might be due to the website. Obviously, there was a huge influx in people trying to get enrolled. But yes, they can call that hotline. They all of us have separate business cards that people can call. They can call the number for Healthcare Alternative Systems. It's 773-252-3100.
That'll also be on the screen. So
yeah, thank you.
It's good for you to share, but it'll also be on the screen.
Yeah, so they are able to contact Haas
Okay.
and get enrolled. And in addition, we certainly partnered with other similar agencies through the whole Get Covered effort. And even on their site as well, people can sort of plug in their zip code or their city and find some place that's convenient to them to get coverage as well.
So how's that partnership worked with other organizations? You guys don't have this turf. I think we were talking about that earlier. We're like, hey, no, these are my folks. I'm going to enroll them. Or how's that collaboration?
Actually, it's really been pretty seamless. I mean, even like in the Brighton Park area, just by example. I mean, there are 2 libraries in fairly close proximity. We worked there. There was another one maybe a quarter of a mile up the road on Archer, and we'd see people who were there, but there was never any, fights or anything like that.
Right.
Not at all. In fact, there are even situations at times where, in these last few days, where we were trying to coordinate. It's like, well, if you need people, if it's overwhelming, let us know. Maybe we can send someone over there to help you. At that point, it wasn't even a matter of competing to see who can get the most people enrolled. It's about, can we serve people? And if you're sitting somewhere and it seems kind of slow, by all means, go to where you're needed. Among our counselors themselves, we not so much have turfs, but some of us, we're part of being what's called an IPC. Is doing outreach. So some of us have sort of developed almost sort of like beats in a certain way, where there might be certain institutions that you've gotten to know the folk and are moved through there very seamlessly. For example, myself and another colleague spent a lot of time at Madden Mental Hospital, and you just don't walk into a mental hospital and start doing enrollments. But
these are individuals dealing with very different issues, right?
Yeah, it's exceptionally good training for dealing with normal people who are simply irate. You deal.
Then you have to ask, well, who is normal then?
Yeah, it's an education. You develop a lot of compassion for folks like that, because in a certain way they're almost forgotten, because many of them are homeless. The only way they get back into a mental facility at times is kind of like by acting out, right? So it's challenges in terms of getting them enrolled and just being able to keep track of them and get their proper paperwork to them and stuff. So you have to figure out creative ways of being efficient in dealing with them, and also develop your own personality skills, because again, it's a range of behaviors, being from perfectly calm to almost, to be semi-delusional at times. I don't want to disparage.
No, it's certainly not. But they are individuals. In my own life, I've had friends that have had mental illness, and it is a difficult path to tread, because you don't know exactly. The person is there, but you don't know exactly how to respond, and it can be difficult.
Yeah, it is eye-opening. Some people can be managed with drugs, and others cannot. And in fact, that was part of the challenges too. There'd be some people who would be medicated, so they would be very sluggish and slow to react. And
when you were filling out the forms?
They would be struggling even to keep their eyes open at some time. And then there are other people, again, who might be maybe not hostile, but disinterested in not really understanding the value of getting health care. So,
right. And how do you tread that path? How do you navigate through that? And you've told me, carefully with compassion, but you also brought up the question of somebody being homeless. How do you assist them in getting signed up for Obamacare? Because all these questions, I think very few of us think about when we think about Obamacare.
Absolutely. When you go fill out a form, you don't think twice about putting down your address,
Right.
your phone number, your email, and you might be dealing with someone who doesn't have any of these things. Fortunately, a lot of the resources there and the website there, they will allow you to, for example, send their information to the nearest DHS office or one that's in reasonable distance from them. You are also, in addition, given the opportunity to allow them to provide a mailing address of a friend or a relative who they can trust to allow to be contacted. Also, same thing with a phone. There's even the opportunity for them to assign a representative, sort of like a power of attorney, not in the legal sense, but sort of like in a way that this person is going to be my representative, and they're going to be allowed to, make affirmative decisions for me, as far as getting this healthcare application.
That certainly makes that clear, because I wouldn't know how that worked, and most of our viewers wouldn't, I'm sure.
Yeah, and again, another part of that challenge, in that particular case too, we would actually sometimes use paper applications. While certainly we have technology, we have the iPads, and we have our mobile hotspots and stuff like that, but sometimes for the sake of expediency, or in order to get as many people as possible, we use the paper applications because you can fill them out very quickly, and then you can go home and enter them in the system like that, because these people are transient. They may be there a couple of days or maybe a couple of weeks at the most, so you've got to move the paper, so to speak, quickly, so you can get back to them with a tracking number, so they can know where they are in the system, things like that.
And I'm sure these individuals, not just those with mental disease or mental issues that they're dealing with, but I think people in general have a lot of questions and fears about
oh,
the
absolutely.
Affordable Care Act. Why does the government want to know all my stuff? And I know a lot of extreme right-wing politicians have been really harping about that. How do you respond to those questions? And what are the biggest questions and fears people come with?
A lot of people are, probably the first concern is, will I get a penalty if I don't want to do this? And it's called the Affordable Care Act, and it is the Affordable Care Act. But for certain people, I mean, it is a kind of sticker shock to a certain extent. I mean, let's face it: if you don't have, $100 doesn't sound like a lot of money unless you don't have $100, right, or whatever. So
true.
So
true.
So it's a little bit of a sticker shock there, but for some people. But part of the education is you say to them, well, think about what this is going to cost if you don't have health care, and not even from a penalty perspective, but you walk into a hospital, or God forbid you break a leg or something like that, you go to an emergency room and they patch you up, you might already be in the whole $2,000, okay, and that's on the modest side.
Right.
So you have to tell them that the cost of not having health care can be extreme. Perish forbid someone should get cancer, for example, and boy, is that eye-opening. Some of these drugs are literally $15,000 a pop, so it's a lot of money. And then from that perspective, a $1,200, $3,000 deductible doesn't seem so bad anymore. If that's what you're dealing with.
Right.
So yeah, it's a little bit of an education, and then there people are concerned about, well, what's the penalty, and in most cases it's like $95 per uninsured adult and $47.50 per person under the age of 18, or 1% of their income. I think whichever is, I don't want to misspeak here. I think it's whichever is greater.
Okay.
But
just in case, they can always call you and double check that.
Correct, correct. The healthcare.gov site has a zillion, answers a lot of these questions. They can research all of that with not a lot of effort, if they're really curious. So yeah, and Yeah, I guess another part of the education, for myself and others, is just the way that Medicare, Medicaid, it sounds like the same things
Yeah,
I've had.
tell us what distinguishes that.
Well, in a nutshell, Medicare is for elderly folks. When you turn 64, usually you get a letter from the government saying, okay, be on the lookout to enroll in Medicare. That's the health care plan for elderly persons. And I believe you will have had some kind of certain amount of months of work history in order to qualify. So what that means is that if you're an elder who just recently came to this country, it might be a little bit of a challenge to get Medicare right away. Medicaid, on the other hand, is more geared toward your income. Thanks to the Medicaid expansion through the Affordable Care Act, all persons between 19 and 64, there's that age again, 19 and 64, can qualify for Medicaid in the case of an individual if their income is at or below $1,344 a month. So we're talking about roughly $650 every 2 weeks. So it's not a huge amount of money, and again, this is a population that previously would not have had access to it. So the good thing about a situation like that is that someone who is, I guess, indigent, they're going to go to the emergency room to get treatment, and that is the most expensive possible care you can get. If they now have a health plan through Medicaid, they can get their whatever chronic illness taken care of, or they can just have their health maintained so they don't have to show up in the emergency room at all and get a doctor and be seen, and it's actually a lower cost on society in that sense.
Right. That's what a lot of people without insurance were doing before, right? They would, and in some sense, I guess, still continue to do. They wait until something's very severe and go to the emergency room.
Yeah, and whether it's out of a sense of macho or they just think I'm too poor to do this or whatever. But yeah, if you don't want to. First of all, it's hugely expensive on the part of the institution, but then it's bad for you too. Obviously, you don't want to wait till you are doubled over in pain to go get yourself checked out. So I think in the long run, this is going to be a huge benefit, and in that sense, it's actually going to bring overall costs down because people can maintain their health.
What about young people, college students? People that just entered the workforce and maybe they don't get insurance through their employer and they're like, I'm not even going to worry about it. I'll just take the penalty. I'm young, I'm strong, I'm beautiful. What do I have to worry?
Well, a couple of things with people like that. Under the Affordable Care Act, people up to the age of 26, they can stay on their parents' insurance. So that's a particularly good benefit, especially given how tough things are right now in the economic environment. I'm sure you've heard of people who they've graduated college, they've graduated grad school, and now they have to come back home and live with their parents. So that's very deflating. So that's a good aspect of it. The other thing is that let's say they're 27. If they're a single person, they can actually get a plan. Again, it's going to be based on their income, based on where they live, and they're going to find, as the president has said many times, that they can probably get a plan that's for the same price of their phone bill, their cell phone bill. So. And people who have been in families where they've had medical emergencies and things like that, they're aware of what these costs can be. So I think a lot of these kids, who are from families like that or who have friends who've been through that, I think they're going to jump on the opportunity to get health care at a reasonable price. You have some people who all they can think about is simply the price, and even if it's $50 a month, it's like, I don't want to bother with that. But I think we have started to create kind of a sort of a culture of coverage, which is a kind of a term that came from our training. And people think nothing of the fact that you have to insure your car. Well, of course you have to
Right.
insure your car. You know, if God forbid someone wrecks it, you want to get it replaced. Shouldn't your body be at least as important as your
Right.
as your car?
Right.
So it's a little bit of a mindset. I mean, in this country, we just have, by an accident of history, the idea that your health care comes through your employers, but more and more that benefit is kind of being withdrawn and sort of dialed back a little bit. So people really do need an opportunity to have kind of a marketplace of insurance where they can go out and get it, and they can actually compete with each other. And under the Affordable Care Act, there are certain things that have to be offered, okay? So that you know, you don't walk in and it's like all you get is a doctor visit and nothing else.
Right.
Things like that.
Right. What about small business owners? How do they fit into this whole question?
Yeah, well, it depends on your definition of small. The good news for, you know, the sole proprietor or whatever, and anyone who has less than 50 employees or 50 full-time employees, they are not subject to that. Okay. So they don't have to start worrying about shopping for a plan or a group plan. But people bigger than that will have to, I guess, turn on their radar. I believe it's coming in November. They will have to start getting involved in the ACA as part of it. I think they had delayed it a year. I guess
Right, that's true.
There was
That's
a certain
true.
amount of criticism and confusion and et cetera, so they delayed that aspect of it for a year. But they will have had enough time to study up and look at what the options are for them as well. But I guess the number for them to keep in mind is not so much 50 employees, but 50 full-time equivalents. What does that mean? That means you could conceivably have 80 part-time employees working half-time, let's say, and still not equate to 50 full-time equivalents. So to me, that's a relatively robust business.
Right.
Definitely. So if you're a little mom and pop, this is, you know, you're kind of going to be under the radar with this. You'll be thinking more in terms of being an individual.
Okay, and we're getting close to the end of the show.
Sure.
One of the questions out in the community, and it's not just I think the overall idea is that a lot of Latinos are undocumented, but the undocumented community is large, right? We have Chinese folks, African folks, folks from all around the world. How do they get covered?
Well, here's how it works. If you are a permanent resident for less than 5 years, if you are legally, let me say legally present is the term. If you are legally present for less than 5 years, you cannot get Medicaid. That's just one example. You cannot get Medicaid, but you are able to get insurance on the marketplace.
Okay.
And even if you are undocumented, your children under the age of 18, that does not apply to them whether they are documented or not.
Okay.
And furthermore, you can come in and get your children enrolled without worrying about repercussions of someone tracking you down or trying to otherwise harass you because you are undocumented.
Okay.
So that's the general rule of thumb with them.
Okay, so as you continue working in this area, what do you tell people? How do you encourage them to say, "Come on, sign up"? Well,
it's twofold. I guess it's a sort of carrot and stick, psychologically speaking. It's on one hand, it's like just think of the benefits and the peace of mind, especially for people who have children. I see that people who have young children kind of get it. They start the light goes on when they start thinking about pediatrician visits.
Right.
You know, if you have a baby that's maybe got issues, you want to be able to know that you can get your child whatever care that child needs without worrying about bankrupting yourself. The other thing is like, again, do you really want to risk bankrupting yourself because you don't have insurance? And even more fundamentally, do you really want to not take care of yourself? I mean, do you really want to not be able to see a doctor when you need? Because you can be as strong and healthy as a bull, but not know what sort of ticking time bomb you have within yourself. And it's important to get out there and get checked out. They call them young invincibles, but that's a perception. That's a self-perception. None of us are invincible.
Right.
None of us are invincible. So it's really important that people avail themselves of health care and make the most of it for themselves and for their families.
Right. So they don't bankrupt the family.
So they don't bankrupt their families. So you don't have your mother worried sick about you. No pun intended. That you're not covered. So.
Well, thanks so much for coming out today and telling us about how you're helping get people informed about the Affordable Care Act and how Haas is participating in this.
Thank you. Thanks for having me.
Okay, great. Perspectivas Latinas is a community service of CAN TV. If your nonprofit organization would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Perspectivas Latinas for local issues and concerns every Thursday at 8:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.